Thank you, and good afternoon. It is really a pleasure to join everyone in this year's scientific retreat. Um, I have to say that, leading up to today, I had a little bit of a technological glitch with my internet, so I appreciate Christina's support in advancing the slides today, so thank you. But your intro, Dr. Duru, is perfect, and I appreciate your reminder to early career scientists considering opportunities in aging research, because hopefully the information I share today will provide as an additional resource for them. I'm actually going to begin my presentation with what is going to be my closing thought for the day. And it's a quote from the Associate Justice Ruth Bader Ginsburg, where she has been quoted in saying, "Fight for the things that you care about, but do it in a way that will lead others to join you." And that is actually my hope and intention in speaking with you today, is to share the information regarding NIA's footprint in aging research and health disparities, research to advance aging science, and to do it in a way that will incite and ignite and inspire you to pursue aging research and health disparities as a career interest. I don't need to tell you all that we're certainly living and working in unprecedented times, largely due to COVID-19. And certainly related to COVID-19, the social inequities that have been highlighted continue to be of pressing interest. So one of the things that I would like to do, Christine, if you could go back to the first slide, I'll let you know when thank you. One of the things I hope to do is to share information that gives you a broader appreciation of the science policy ecosystem that we are operating in here at NIA, our research priorities. If you could please advance to the next slide. The next slide, please. The research priorities, thank you. The research priorities and a few examples of tools and resources that we have funded through our extramural portfolio. And then I'll say a few words about career advancement and training opportunities that support investigators across the spectrum of their career trajectory. Next slide, please. So many of you are probably familiar with science policies that NIH support. They apply to each of the 27 parts of the agency as a whole. Next slide, please. But the history has very long origins, going back to the late 80s, where we have the policy related to inclusion, first promoting women in studies. And then a few years later, the requirement was broadened to promote diversity and inclusion in studies, to go beyond women and include minorities in NIH clinical research. A few years later, the policy was further expanded to promote inclusion of children. And in recent years, the policy was refined more specifically to revisit the definition of children from 21 years of age to those under 18. And then in recent years, there was an important piece of legislation, the 21st Century Cures Act, that further expanded the age discussion around including older persons in research. We've had a few workshops that NIA has hosted. Most recently in September, we hosted an additional workshop to further explore the role of diversity and inclusion across the lifespan and revisit efforts that we are supporting to promote the inclusion of older persons in clinical research and clinical trials. But this policy has been with us for many years and serves as an ecosystem that supports the research that we fund at NIA. Next slide, please. And as that policy has been analyzed, we have identified looking at 10 disease areas that resulted in hospitalizations or other more extreme effects of older adults, looking specifically at mean age and the inclusion, exclusion criteria and age requirements for older adults. And also within the children category, looking at extramural grants that were associated with publications, again, reviewing for inclusion of children and coding for age. We found some interesting results. Next slide, please. And in that, we identified that at least a third of the studies had an arbitrary upper age limit, and there was indirect exclusion factors that may have been implemented in terms of comorbidity conditions and various medications prescribed. And so this just sort of speaks to the importance of revisiting at the clinical trial, clinical research design level, what our policies are and how we go about crafting research projects that are age-friendly and intended to enhance the diversity and inclusion of older persons. Next slide, please. Next slide, please. Thank you. And in terms of the guidance provided in terms of applying the policy, as I mentioned, there's been a consistent presence across the agency related to diversity and inclusion, but of course we are not at a place where we can rest on our laurels and consider our work done. We have quite a bit more to do in terms of incorporating lessons learned in new studies and trials where we can be yet more specific and do a better job in terms of engaging older persons in our studies. So specifically looking at NIA and our budget and strategic plan, next slide, please. We, if you could, thank you. We have the NIA strategic directions for research document, which has recently been updated. It is in place for the next 5 years, and this really serves as a compass that anchors our extramural research activities and portfolio that we have in place. The intention is to serve as a point of reference for our priorities and to underscore the dynamics of aging process to improve health and well-being and to further support the research enterprise as a whole. Next slide, please. And so to that point, the strategic directions calls out specifically health disparities. And as you can see here on this slide, more specifically, it really is understanding health disparities among older adults, developing strategies that promote active life expectancy, and also developing and implementing strategies to increase the inclusion of diverse populations in research. So that this F3 is really an opportunity to develop additional methods and processes that support the inclusion of older persons in research. Next slide, please. So from a review of our extramural portfolio, looking at what we've funded over the last decade, as you can see from this slide, there has been a marked increase in appropriations from Congress to our institute. And a good portion of that, next slide, please, has been allocated for health disparities spending. As you can see, the increase has been fairly consistent as there have been additional resources overall. There's been additional spending in health disparities specifically. Next slide, please. In addition, Congress has provided additional appropriations that's focused specifically on Alzheimer's disease and Alzheimer's and other related dementias. And as you can see across this trajectory, the increase has been pretty significant from 2015 onward. There was a little bit of a drop in the last year, but overall, the increase has been pretty significant from 2015 onward. Next slide, please. And so while the appropriation has been pretty significantly increasing over the past several years, those resources are not siloed, if you will, just within our institute. We collaborate and partner with different institutes across NIH that have a shared interest or a particular viewpoint from their disease condition that they have expertise in, and provide supplemental funding to advance the research from that perspective. So this slide just illustrates the footprint, if you will, across various institutes and centers, with the Neurological Institute, NINDS, having 41 supplements in FY19, all the way through the National Library of Medicine and dental and cranial research. So there's really a broad partnership and collaboration around aging research among the different parts of NIH. Next slide, please. So looking specifically at Alzheimer's disease and Alzheimer's disease and other related dementia supplements to parent grants and health disparities, there have been specific efforts to collaborate with the National Institute on Minority Health and Health Disparities to reduce the assessment of barriers for patients with low literacy, supporting efforts around system factors on racial disparities in nursing home quality of life, and also looking at biological mechanisms of risk and resiliency in brain aging among ethnic minorities. Next slide, please. And in doing so, those are just a few examples of parent awards that are supported by a different IC, a sister institute, but have a shared interest in addressing Alzheimer's and other related dementias. This slide just illustrates, again, funding across the different components from FY16 onward, and just further underscores that the partnership and the commitment to address health disparities, to address aging research continues to be quite prominent across the agency, with NIA in the lead for this scientific effort. So next slide, please. To just focus a little bit on a few examples of some of the research that we are currently funding that address health disparities. One of the projects has to do with looking at the progression of Alzheimer's disease and related dementias within the brain pathologies. And as illustrated here on this slide, this particular study is looking at primary prevention in terms of delay onset of the pathology and decreasing aging by other production of issues and prevention of the tangle formation. The secondary prevention aspect of this study is looking at delayed onset of cognitive impairments, and the tertiary prevention and treatment part of the study is looking at the delayed onset of progression of dementia and other neuroprotection to prevent neuronal loss. So this is just one example from a basic science perspective where health disparities and aging research is being supported currently. Next slide, please. Another example, there are a number of studies that are currently being supported that cover the full range of drug development, from exploring the target ID and early validations all the way through supporting phase 3 clinical trials, leading up to the drug approval process. Next slide, please. And specifically, those studies, we currently have about 230 clinical trials underway, 37 of which are in the early stage clinical drug development side of the spectrum. About 9 or so are in the late stage clinical drug development end of the spectrum. A little over 108 or 7 or 8 are non-pharmacological interventions, looking at exercise, diet, sleep, and some combination of therapy and other types of interventions, We have 8 clinical therapy studies that are looking at pharmacological as well as non-pharmacological components, and about 67 studies and trials that are looking at care and caregiving and developing efficacious interventions. So this is just illustrating the broad range of active awards that are looking at different components of aging and other related dementias. Next slide, please. So in terms of focusing on minority recruitment efforts within the various, the biomedical enterprise in general, we have a couple of funding opportunities currently open. PAR 18749 specifically has supported 5 awards to date that look at the diversity, recruitment, and retention in aging research. We have approximately 6 awards under 18-047, and that is encouraging applications to look at the mediating factors that may promote disparities in aging and Alzheimer's disease using diverse cohorts of subjects that focus on different approaches for recruitment and retention in clinical trials. So this is just a couple of examples of resources that are available to further explore how we can enhance minority recruitment efforts in studies and trials. Next slide, please. An additional effort, something that was launched in October of 2018, looking at a national strategy focused on increasing diversity and participation in clinical studies. And this is called ADORE as a resource. And ultimately, this is a repository that is made available for people to support recruitment and retention. This is a very, very short video. Christina, are you able to play the video? Thank you. It's about 30 seconds. Are you able to hear that?
No.
No.
Oh, okay. Well, it's a brief video of a woman sharing her testimony of what motive.
It's about future generations. That's a good feeling.
Can you restart that?
I'm not sure if you're able to go back and start it from the beginning.
I think you're going to hit replay at the bottom.
Yeah, it's the little arrow that's like curved right next to the volume bar.
No, below that.
Bottom left.
Yes.
There you go.
Perfect.
My mother gave me a gold coat that not only warms my body, but it warms my spirit. When she was diagnosed with Alzheimer's, it was quite a blow. Alzheimer's doesn't just affect a person, it affects a family. She would be very proud of my participation in the research because it's not about me, it's about future generations. That's a good feeling.
So this was just one example of efforts that NIA is supporting to promote minority recruitment and enhance diversity and inclusion in our clinical trials and studies. Next slide, please. Some of you may be familiar with this data. This is a report that was an assessment of interventions prepared by AHRQ and the National Academies, looking at interventions to prevent Alzheimer's disease type dementias, and essentially identifying a possible association between managing blood pressure and cognitive impact on individuals. Next slide, please. One of the studies that we currently support builds upon that hypothesis, and it's called Sprint Mind Research Question, looking at the randomized controlled trial targeting systolic blood pressure, excuse me. And so this is just another example of clinical research underway that further explores the relationship between other issues that may not be fully documented, but certainly give insight to possible relationship to dementia related conditions. Next slide, please. As a secondary cognitive outcome, this particular trial is looking at reducing the rate of developing MCIs and also reducing the rate of composite MCIs and probable dementias. So this is certainly a study that we're particularly mindful of. And I want to highlight in terms of the point made earlier about minority recruitment and retention and addressing health disparities. To date, this particular study has about 30% African-American individuals that were enrolled, about 36% female enrolled, and just shy of 11% Hispanic Latino communities enrolled in the trial as well. So it's certainly one of our more diverse studies to highlight. Next slide, please. Next slide, please. Another study that's supported in one of our programmatic divisions looks at the genetic risk factor for Alzheimer's among African Americans. And essentially it's, highlighting a regional association in African Americans and Caucasians, specifically looking at the ABCA7 region. And it's, again, just highlighting the breadth and depth of the type of science NIA supports to answer important questions related to aging research and addressing health disparities. Next slide, please. This slide is just illustrating that the greater educational attainment may have influence on, in terms of an impact on African American, Black, and white, reducing later life dementia. This is work that's been supported through the Behavioral Social Research Division within NIA, and essentially looking at individuals 65 and over that may have varying degrees of education. We see that there are some differences observed, but this data also showed that while there may have been some protective effects for African American participants, those effects may not necessarily manifest in the same way for the Hispanic Latino community that were involved in this study. And it just further underscores the importance of exploring disparities that may stymie the ability to disseminate findings more broadly as we learn different components about aging and aging-related conditions. Next slide, please. This particular slide is highlighting the interrelationship of ApoE4 with tau in African-American individuals and how this may differ from Caucasian individuals. Again, just highlighting the breadth and depth and diversity of studies that are supported by the National Institute on Aging, where we're looking at racial disparity and biomarkers for Alzheimer's disease. Next slide, please. I think the take-home message, just to underscore here, is that there was a statistically significant difference in terms of the positive factor for African American participants as compared to non-Hispanic white participants. Next slide, please. I think there's one slide just before that. So looking at younger African American cohorts that may have a higher educational attainment, this slide just underscores differences by gender and by race ethnicity, looking at dementia-free probability by age, and again, underscoring the importance of researching questions related to health disparities in aging research. Next slide, please. And as you can see here, there is a marked decline of those with, this is a neighborhood study looking at the relationship between sleep and cognition in individuals living in a lower socioeconomic community, there may be differences shown here in terms of quality of sleep as expressed by high versus low neighborhood SES. So this was a different approach looking at the relationship between SES and the effects on aging and sleep, but again speaks to the diversity of the portfolio. Next slide, please. Next slide, please. So just focusing a bit on aging research and disparities, not necessarily Alzheimer's or related dementias, but aging in general. We've have a study that looked at the difference among 65 and over the period of 1981 through 2014, and essentially observed that at 65, women can expect to live about 2.5 years longer, and at 85, women can expect to live about a year longer, and that the differences by sex are seen among African American, Hispanic, Latino, and Caucasian communities alike. And in terms of race, but looking at differences decreasing by age, in 2014, this life expectancy at birth was about 3.4 years higher for Caucasian persons as compared to African American. But at 65, for Caucasian persons, you can expect to live about a year longer than African Americans. So the survival among those who survive to 85 years of age, the life expectancy is slightly higher. So again, just illustrating the breadth and depth of the portfolio. Next slide, please. So in terms of initiatives addressing various types of disparities led by NIA, there are a number of funding opportunities. This particular one, 17164, focus on aging biology specifically, looking at health disparities. There are 2 supplements that were supported by the National Institute of Minority Health and Health Disparities, but the parent sits with the Institute on Aging. The next funding opportunity is led by our Geriatrics and Clinical Gerontology Division, the third by the Behavioral Social Research Division, and we have another looking at an R24 at basic biology and aging. So again, just illustrating the interest in supporting the full range and stages of research that help answer important questions. Next slide, please. So this particular slide just illustrates that the role of drug and alcohol and suicide mortality, looking at white non-Hispanics by birth rate. And there is a publication available on this. This is provided some background from Case and Deaton that was later helpful in further supporting research that NIA ultimately supports. Next slide, please. And again, looking at drug and alcohol and suicide mortality, you can see that there are some marked differences by age over time and by groups of individuals. Next slide, please. So in terms of what we support, building off of that broader scientific justification that there is a relationship among those factors, there is a project that we are supporting that looks at eliminating cost sharing and increasing mammography screening in Medicare Advantage participants. This is an activity supported by our Behavioral Social Research Division. And essentially the finding here is that looking at Medicare, because of age appropriate screening, you can reduce mortality from breast cancer. And while the recommendation from the U.S. Preventive Task Force recommends screening between 50 to 74, women aged 60 to 69 are more likely to avoid breast cancer death through mammography screening. But eliminating that cost sharing helps remove a barrier in women seeking the screening as a means of preventing breast cancer. So that was the take-home message there. Next slide, please. And this further illustrates the shift and change of eliminating cost sharing versus never having cost sharing. It does make a difference. Next slide, please. So in terms of COVID-19 specifically, NIA, of course, is very committed and has been engaged in the agency-wide initiative responding to COVID-19. Many of you are probably familiar, if not supported, under efforts called RADx Up. This particular funding opportunity announcement 20-234 is really intended to explore the efficacy and safety of interventions that target aging-related biological mechanisms. It also supports the efficacy and safety of preventive and treatment interventions in vulnerable older patients with comorbidities. It supports rapid pragmatic trials in health systems, nursing homes, or adult living facilities to promote enhanced quality improvement in physician, hospital, palliative care, and hospice practices, and also supports the effectiveness of health and or custodial care practices to reduce the transmission and improve outcomes of COVID-19 infection in residential settings in nursing homes. So this is one example of an NIA-led COVID-19 funding opportunity announcement. Next slide, please. And while NIA is not necessarily leading this community engagement award, I did want to share that this is another agency-wide COVID-19 response. We are definitely in the conversation space, leading scientific directions to promote better inclusion and diversity, and including older persons in the research agenda. This particular initiative provides $12 million to quickly launch outreach efforts that can help reduce the impact of COVID-19 on the most vulnerable communities and evaluate those efforts using community engaged research. There were 11 awards announced, and among the 11 is an award to UCLA. So I want to acknowledge Dr. Arlene Brown and her team as the PI leading this effort on community engaged research to address COVID-19. Next slide, please. So additional resources and tools available really cover the full breadth of examples. So the first I want to share with you, many of you have probably seen, if not used this, is the NIA Health Disparities Framework. This framework it includes 4 components, as you can see, and it lists out the priority populations and a life course perspective. We within NIA use the framework from a planning perspective to assess the relationship or correlation between the funding efforts that we've made and where they align on these dimensions of the framework. And certainly as investigators in the research community can use this tool as they're crafting out and designing or adapting existing studies to be more responsive to these components, whether it be an environmental factor, social cultural behavior, or a biological factor. So this is one tool available to the research community. And as I mentioned, we use it as well in our planning efforts within NIA. Next slide, please. Another tool available that was established in 2012 through a collaborative effort is the National Strategy Promoting Recruitment and Participation, called Together We Make the Difference. This was a very extensive effort led by NIA staff, engaging stakeholders from the caregiver community, study participants, individuals with a commitment and interest in aging research, representatives from other parts of government and academia, and of course private sector, all working collaboratively to chart out a new pathway that serves as our national anchor for recruitment and participation in terms of how we go about engaging clinicians, family members, how we utilize media, and addressing national and community-based organizations in the discourse around aging research. Next slide, please. Another tool available to researchers is something that's supported by our Division of Neuroscience with some supplemental awards to the parent, supported through our Behavioral Social Research Division. This is a project called Neighborhood Atlas, led by an investigator at the University of Wisconsin, looking at neighborhood in terms of disadvantaged metrics, making information more accessible. And the website is an interactive website that's open to the public. You can click on the link, fill in a few drop boxes with some specific information to the community that you're interested in looking at, and it will populate details that you can use and incorporate in your research projects. So I just wanted to share that with you. Next slide, please. You're very familiar with this resource, the Resource Centers for Minority Aging and Research, RCMAR, so I don't have to say much about that, other than to emphasize that, of course, we have 11 RCMARs across the country, and many are very involved in different aspects related to aging research. Next slide, please. So shifting gears a little bit, I wanted to say a few words about resources to support investigators who may be early in their career thinking about moving into the space of aging research. The first award available through NIA is called GEMSTAR, and it's specifically a grant for early medical and surgical specialists who want to transition into aging research. I provided the link here. If you would like more information from our training office, you certainly can visit our website, contact anyone here, and we'd be very happy to discuss the possibilities of this application. But this is one resource called GEMSTAR. Next slide, please. The next resource is the Paul B. Beeson Emerging Leaders Career Development Award in Aging Research. And the purpose of this funding is to support new investigators beginning to establish their career in research programs. And we want to help position them to assume leadership roles in aging research and to really leverage their scientific expertise in changing theory, practice, and health outcomes that are related to the health of older individuals. So this is a resource that's supported by NIA, the American Federation for Aging Research, and the John Hartford Foundation. Next slide, please. And the other resource that NIA makes available is an activity supported by my office, the Office of Special Populations, the Butler Williams Scholars Program. Last year was 2020, this year was our first time offering the program in a virtual format, largely due to the COVID-19 pandemic. And we are anticipating that that will be the format this will be delivered for 2021. But this is a training opportunity for individuals who hold their doctoral degree and have an interest in moving into the aging research arena. Next slide, please. The intention is to support junior faculty who want to continue growing their skill set, not only in aging research, but also in terms of health disparity research and identifying what are health disparities as they go about developing their individual projects. We've had an opportunity to look over the years at the Butler Williams Scholars Program. The predecessor to this program is called the Summer Institute on Aging Research. So we have 34 years of history in providing training to early career investigators aspiring to make aging research their home. And we just did a quick sampling looking at the last 3 cohorts, 15 scholars each. looking at awards that were pursued either as a K or a T. We did not include L or F awards. And we found, next slide please, that many of our scholars from 2013, 14, and 15 went on to be quite successful in applying for additional grants, receiving the grants that they were pursuing, and publications, and moving into their first R01 within 4 to 5 years of finishing the Butler Williams Scholars Program. Next slide, please. It is a program that supports individuals from a variety of disciplines and fields. We've had scholars who've applied with an interest from any number of these institutes listed here. So we certainly welcome a broad swath of individuals who are thinking about pursuing aging research with any number of research hypotheses in mind. Next slide, please. Just a few publication metrics to share with you. Many of the scholars go on to be very prolific. They have 372 publications among them, with an average citation of just under 14, with a median of about 1.4. So we're quite pleased with the direction many of the scholars have gone in, and they've taken the resources and done great things in their career. Next slide, please. And to that end, I just want to share that there are some additional resources if you are further along in your career and revisiting if aging research is something you'd like to add to your scientific repertoire. There are training awards available and career development awards available. And so I'm just sharing those links there for you to consider. Next slide, please. And just to say that the last 3 years, the National Institute on Aging has been coordinating for NIH the Research Diversity Day. That is Wednesday, the 21st. And this year we are focusing on those in their undergraduate space. And I just want to encourage everyone to join on Research Diversity Day and learn more about the opportunities. Thank you. Any questions I'm happy to take at this time. I just close out with Ruth's quote, "Fight for the things that you care about, but do it in a way that will lead others to join you." And I hope the information I shared today has inspired you to join me and my colleagues in addressing health disparities and advancing aging research.
Thank you, Dr. Jones. That was terrific. It's always so helpful to hear what NIA is doing, all the exciting research and the opportunities for the scientists out there. So thank you again for joining us and for the terrific talk.